Next up, we have nothing on the general consent agenda. So we'll move up to new business. I would accept a motion to approve the additional ARPA spending requests. Motion by Mr. Bartel.
Second.
Second by Mr. Curry. Discussion. Ms. Bartel?
Yes, on the Northern Illinois Food Bank, we'd prefer not to do that tonight yet. I'd like to put that one at least on hold.
Further discussion, Mr. Van Laar.
We had asked the health department for a list, a modified list. Do we have that?
Yep.
Mr. Kelly.
May I? Okay. So tonight, yes, we have invited the health department, Amanda Mel, public health administrators here to share additional details on requests and the prioritization process. And then I also have the food pantry online too. So tonight we'd like to invite Amanda up to discuss the additional requests, and we have a few slides to present on that, or a couple of slides rather. In the packet was also attached additional clarification packet, and then also project descriptions for the Boone County Health Department project submittals. So we'll bring up those slides and invite Amanda up to discuss further.
Good evening, everyone. Amanda Mail here with Boone County Health Department. Kevin has pulled up some slides. I know there were some questions last week regarding the health department's prioritization process when responding to county admin in terms of putting together our proposal for request for ARPA spending. And so just so that you all know, the process for our prioritization that our department uses is taking a look at short, medium, and long-term goals of the department. So short-term currently would be COVID-19 mitigation and response. Medium term would be COVID-19 recovery and transition to long-term goals, which are items or programs or services that can be used for the department towards other initiatives and efforts. And will that purchase be sustainable, and will it outlive COVID-19? So is it something that we can continue to use for the sustainability of the department well past the time that we're in short-term mitigation and response? And so the other questions that we ask when we go through this process are, will a current grant cover this? As in, is there somebody other than ARPA that can cover these expenditures? Could we write a grant to cover for it? Will it benefit departments more than just the health department? So thinking broadly outside of the scope of what our individual department does and looking at the county governmental system as a whole. And then the report that we provided in October of 2021 here just a few months ago was already organized in priority order. So staff to do the work, stipends for additional staff, 3 is equipment to support staff, and 4 is lost revenue recuperation. Next slide. And the process for prioritization in terms of using those questions and then moving it through our command structure. So it's reviewed by our health department incident command team. So that's made up of our emergency response coordinator, our director of operations, frontline staff, as well as mid-level supervisors. Then that goes to my position, the health department administrator, for review. Then it goes to the Boone County Board of Health and the county board liaison, who participates in discussions. We had a series of 4 meetings at the Board of Health level where we went through piece by piece, bit by bit, the prioritization process and had discussions with our Board of Health to determine if these questions had been adequately answered and if these purchases met the short-term, medium-term, and long-term goals of the department. Then we forwarded that on to county administration. And in discussing with Mr. Catlin, it was my understanding that county administration went through a vetting process. They took what we had submitted, went through their own vetting process. And then Kevin invited me in for a conversation, and we went through this process yet again and took a look again at the short, medium, long-term goals, the 1 through 4 that I outlined. And then that's how that proposal came forward to you all in October. So I did include a copy of the 6-page ARPA proposal that we had created for our Board of Health that was passed along to you all in October. We re-included it just to make sure that everybody had a chance to take a look at that again. And that goes through narrative of all of the items and the staffing plans and a short written justification for each one of those. And then in addition to that, you all had asked me to sort of further clarify those 4 categories, which I did in a page and a half document. So we can go through that here real quick. Kevin, I think you have that up on the screen. Perfect. Thank you. So if we look at this and we look at the top, the mitigation COVID-19 response number 1 staff salaries was reviewed and voted on in October 2021. There are a few items that have strike-throughs in those. Those are items that were eliminated as part of the prioritization and vetting process that we went through that I just got done outlining. Number 2 is the stipends. We have not yet requested those. 2 of the items there are on hold per county admin's request to address those with those specific county departments and figure out exactly what their needs might be. Number 3 is equipment, which is what is currently under review. You'll notice that there were several items with strike-throughs, and I did indicate with an asterisk at the bottom, again, for clarification's sake, that those are items that are currently on hold because we're getting more bids or we're looking more into those items to figure out if there might be a better price or there might be a more local option for purchase. Those are just some examples of some of the reasons why we are holding those right now. And then there were several items per recommendations in the vetting process with our board, with county admin, with our county board liaison to the Board of Health that have been eliminated for the time being. Then number 4, lost revenue is not yet requested. We would like to recoup that lost revenue, but it's not in our current sort of dire situation to get moving on some of the activities that we want to be able to do with the staff that we're in the process of onboarding and the equipment that we're requesting now to be able to be used by the staff to begin to meet those short and medium-term goals that we're already in the process of implementing. Mr. Catlin, I'll turn it back to you.
Questions for Health Department?
I have a question.
Mr. Curry?
Going in a little bit further on the vehicle, I know that it's kind of necessary to have a little bit more durable of a vehicle. I think some of the stories that your staff had shared that they get stuck in the mud and aren't really rural use vehicles. We obviously live in the country. So I think that's probably one of the, I don't know if you can put that on there, but just to reiterate why an SUV is probably a little more necessary than a drive car going to some of these sites.
Mr. Curry, you're talking about the SUV or the Health Department wheels vehicle?
The SUV.
The SUV?
Yep.
So second vehicle? Okay. Any other questions for the Health Department? Mr. Schabacher?
And sometimes I'm not always on target, but if you'd be looking at getting a new vehicle or new vehicles, I don't know if there's electric vehicles out there for what you may need. Being that the board might be looking in the future for a charging station or something. And that's just something off the top of my head. So I might, like I say, I might be way off base on that. If you were to look at a vehicle, I don't even know if the type of vehicle that you'd be looking for would be electrical at this time, so I don't know.
So we don't currently have an electrical vehicle in the fleet of vehicles that we do have. We're definitely open to that as an option, of course. What we've done in the past is we've worked with the sheriff's department because they have good working relationships where they purchase their vehicles locally. And a vehicle that we were able to purchase that was specifically for some of our environmental services, we went through that local channel and that was successful as well. So we would probably start there, and the quote the amount that's listed here reflects sort of the average cost that it has been in the past to purchase locally. We'd really like to purchase that vehicle locally if possible, because then we keep that money here and we support our local businesses.
I only threw that out there in case the county here would vote to investing into a charging unit,
Sure.
where vehicles in our community or, for the county would be considering electrical for that purpose to save some money if we put it in. Thank you very much.
Welcome.
Mr. Curry?
One more comment, I'm sorry. The mobile vaccine and testing unit, you said that there are long long-term use for that, not just focusing on this pandemic as it is or COVID. Is that something that you could convert and use like at the fair and during functions as like a housing unit for the staff while you guys are out there? Is that something that, what would you use it for after, this slows down or hopefully quiets down?
Right. So I don't know if you all have seen, and the one that we're considering isn't quite this big. I don't know if you've all seen like the Ronald McDonald Care Mobile, but the purpose with that is it's a functional clinic on the inside. It can be driven anywhere, in multiple counties, parked in front of a school, parked in front of a health center, parked in front of a grocery store parking lot, and can be used for a variety of different services. So dental care, childhood immunizations. I'm not talking about COVID. I'm talking about required immunizations for school, teen vaccinations, STD testing. What we find here is that we've got a lot of more remote areas of our county where it can be even a struggle for some of the families that use our services to even make it to Belvedere with reliable transportation, for example, for their WIC vouchers or to be able to get an immunization that their child is behind on. So this would allow us, yes, to go to the fair, to participate in activities in the community, to park ourselves around the county, but it would also allow us to take a lot of the services that are traditionally housed in our building here next door and move that to strategic locations in the community to serve the community where they're at. We do have transportation barriers. We have quite a few language barriers in this community. So I have bilingual staff that get deployed to provide services, and having a vehicle where we would be able to do those things would be greatly used and needed well past COVID.
That was a question not staged by us. I honestly did not know what was actually.
Mr. Robertson?
Could we not purchase the vehicle for them through the state bid?
I would assume we can purchase any of these vehicles through the state bid. I would assume so.
I'm sorry.
Go ahead, Ms. Bell.
Sorry about that. So the SUV, again, what we've done traditionally when we've bought vehicles for our fleet is we've worked with the contract that the sheriff's department has. We've looked into state contracts as well. We really want to purchase local and keep that money local if we can, which is what we've done in the past. We're really open to purchasing, anywhere, which is whatever's in the best interest of keeping money here locally. The van vehicle, so if you can picture what the Ronald McDonald Care Mobile vehicle looks like, you can't just get that at any auto dealership, right? So there are several counties that have used COVID funding to purchase these types of units, and we've been able to speak with those departments. And actually, I have a couple staff members that are prepared to visit a neighboring county and take a tour of the mobile vehicle on the inside, figure out what's working and what's not, learn from maybe some of the things that they didn't purchase to be in the vehicle that we might choose to purchase that would be part of the package of the van, and then be able to service our specific needs better.
Ms. Kieske?
I think I'm gonna ask for some balance here. You can go to just about, I think, any pharmacy, any grocery, almost all grocery stores. You can go just about any place and get poked. By the same token, are we duplicating services because we also have a transportation system in this county that will take folks where they need to go? So are we doubling up by buying another vehicle to transport people? I'm just trying to sort this out in my head.
Ms. Gieseri, in reference to the mobile van unit, the clinic, or the SUV, just so that I'm clear?
Actually, both.
Okay, so the SUV allows for the additional tasks and duties currently for short-term and medium-term COVID-19 response, and then would outlive COVID in the sense that some of the additional programs that we're currently developing. So a good example would be the explosion of behavioral health and mental health services that the health department is helping to spearhead. As that program grows, and if we have a fleet of vehicles that allows us to encompass the additional staff that are brought on for a variety of programs way past when COVID is hopefully over and done with. And by the way, where is the COVID off ramp? Have you found it? Because I would like to get on that. That would be great. So once the COVID off ramp, we can take our SUV on the COVID off ramp and had for our long-term vision of those types of services. In terms of the mobile van, I will share with you that STD testing is not provided at local pharmacies across the county. Specific childhood physicals and immunizations are not offered at a lot of the facilities here in our area. People have to drive to a neighboring county. They have to drive to Rockford to get those services. Our department is the sole provider of the Women, Infants, and Children program and the Family Case Management program. Those programs are unique to public health and unique to the health department, and we want to be able to provide better access to services for the residents in this community.
Thank you.
I think
Question.
just one other thing on, I'm sorry, one other thing on that, what you were saying, Amanda, I have to agree with you because I think, God forbid any of us have to live through this again. Places that you mentioned, Sherry, those probably going to be, if we go through something like this again, those places are probably going to be closed, just like we were in the beginning of this. So your vehicle would probably be the only thing that would be available for a while until we got it under control and we're able to open facilities again where people could get what they needed. So I support it 100%. I think it's a good idea. And I appreciate you taking the time to trim down what we ask you to trim down what you needed. And it gives us a little bit better idea what we need to do here. Thank you.
Further questions for the health department? I've got a question. I guess what I was envisioning is that you were going to take these 4 items that you've asked for here and prioritize those 4 items, 1 through 4. I thought that's what we were kind of asking for at the last meeting of this ask. And which were the more important ones to you and the health department? Can you tell us that today, if you had to rank them 1 through 4, what they would be?
I was under the impression that my ask from you all was to give you some clarification on what had already been prioritized, which is what I did. As far as the 4 items that I'm requesting all 4 this evening respectfully.
Yeah. I would, I certainly am not interested in spending $40,000 on a monument sign for out here. I don't think that's a drastic need. Again, I keep harping on this. Just because we have this money in our pocket, we don't have to spend it right now. We have 4 years to spend this money. And we just utilized these funds to help pay for corrections and deputies' salaries for the last year. And I'm assuming, Mr. Catlin, perhaps you can let me know if I'm incorrect, but I'm assuming we can do that going forward also. If we were able to use part of these funds currently for that, I'm assuming we can continue to do that. And assuming we can continue to do that, it's, in my opinion, the county's best interest to be able to continue to do that and allow that money to get into the general fund and then be able to do what we see the greatest need throughout the community with that money. That's my personal opinion. Again, I appreciate all these things qualify. They can be used. I would agree with Ms. Bartelt. I'm not anxious to spend $50,000 with the food bank. I'm not anxious to spend $40,000 on a monument sign. I can see the need for the SUV. The rest of it, I guess I need to be convinced, but Mr. Van Laar?
Yeah, I'm agreeing with you. I don't see the urgency in any of these 4. I would like to, once again, wait on spending this money.
Any other, Mr. Catlin?
I guess if the board wouldn't mind, I guess I'd like to reiterate, the funds are to be used for the specific categories that I outlined in the presentation. The money is, it's not proper strategy to sit on the money. The money was disseminated by the federal government to make an impact now. We have rules in place that the U.S. Department of Treasury put into place to obligate the funding by 2024. That does not mean that we should sit on the money until 2024. The money cannot be used as a rainy day fund. That means that we cannot just have it just sitting in an account, and if an economic downturn hits, we can just spend the money on anything related to an economic downturn. It can only be spent on the categories outlined in the presentation. So waiting for another crisis to hit would not be wise. The public health administrator just gave a really good or provided a really good detail on how resilience is built in to this American Rescue Plan. And that was obviously communicated through the Health Department on Wheels. And so to not have the forward thinking and I guess the foresight to plan will really hinder us in the long run to just sit on the money and not actually utilize it in the best way that we can now. To the comment about public safety payroll, we were able to do that last time because the board designated all staff as essential to mitigating COVID-19. The board has not necessarily reiterated that for 2021. It would be quite the stretch to insinuate that corrections, sheriff's office, deputies patrol, and corrections, and obviously all other kind of public safety employees are mitigating COVID-19. We have to provide that justification. The justification that we provided the last time for the $2.8 million was on the record that the board had classified public safety, all of public safety, and all county employees for the most part as essential. So we have to just be careful again. The actual record keeping on this is pretty restrictive and watched over very carefully. So, but I think that's why these requests are being presented, because the health department believes that they need these items to mitigate COVID-19 today. In 2024, we may not have COVID-19, and that's why through the prioritization process, we've explained that these will have long-term implications and impacts, not just mitigating COVID-19. I know the food bank is on the line too. I know that the board has spoken on them for just a little bit, but I know that they had a few things to share if they can.
Mr. Van Laar?
I think the US government needs a reality check. We do not need these funds. So we have admin speaking to us about how we need to quickly use these funds and point these funds in the direction that they have to be spent. And I understand this is funny money, free money. But it frustrates me that we have this money to begin with because we don't need it right now. It's a poor use of taxpaying money.
I just need to point out that in the recommendation from administration, the administrative department says, however, the board may approve any rendition of the request presented tonight, which I think that's what we're trying to do, is trying to determine which rendition we're going to use. And I think what we seem to be doing is talking in absolutes. Absolutely, we have to spend all of this for all these things, or absolutely we don't spend any of it. And I think what we really need to do is, I'm in agreement with Jonathan. I think we just need to take a deep breath and back up. Something that was just said, we have until 2024 to do prioritization. Well, we're not even 2022 yet. So I think we should just leave this money, and I might disagree that you can't tuck this money away, because I think you can tuck this money away, and perhaps we should. So I think we all just need to kind of put the brakes on a little bit.
Mr. Curry?
I don't disagree with that. And if this was a $7 million that we were spending, I would totally agree with that. We're talking about $269,700 of items that are presented from our department head saying that it is something needed. We're not in those departments. We have to trust in what they say is needed at this time. We don't do Amanda's job. We don't do the sheriff's job. We don't do food bank's job. We have to trust in their opinions. I'm not saying we give them everything, but they're also not asking for items that are absurd either. It's not saying we can't sit on the money for a while. They're not asking for all the money. They're asking for items that they need right now. A touchless X-ray machine, temperature check, metal detector. Why are we not going with those two and asking, you know, what is the need for those right now as well? Obviously they're needed because they're asked for. But we're not spending all of the money. This isn't something that, this isn't money. We're bringing Boone County into 2022 here. A lot of these places have these items. We're trying to grow Boone County into something that is of the time so that we can, as Rod Riley say, approach these without, you know, being caught off guard. These are things that we can use that are needed. So I'll agree to disagree. I do think it needs to be well spent and properly spent and well managed and carefully spent. But I don't see this being frivolous. I don't think this being irresponsible. I think this is a need that's for the county, and I don't see anything wrong with the items presented. A marquee, definitely not needed right now. But in the future, maybe, I don't know.
Mr. Wiltsey?
Yeah, I'm frankly a little confused because I thought that what I envisioned when we talked about prioritization was it was going to come back and, for example, maybe somebody would say, okay, you know what, we can get by with 7 of the laptops instead of 10, for example. And we all know that the laptops only last 2 or 3 years, maybe. And if we buy them all now and then we don't have a chance to rotate some in. Unless I misread it wrong, there was actually an indication that we had bought some refurbished ones. I'm using my word. I think it was a different word used. And now they want to do 15 laptops instead of 10. And there's a different dollar amount. There was a 22,500 or something like that. So with respect to, I was also expecting that maybe instead of everything coming back being priority 1, there might be like some analysis. The SUV would be more important than the wheels vehicle, or vice versa, or something like that. So that's the problem I'm having with this right now. And didn't we just see? Isn't one of the documents with the strikes? Didn't that remove the monument sign? I'm trying to understand how that is presented then, because we've got a dollar figure on this 269,700, which has the monument sign, and there's no, I didn't see a dollar sign on that strike list to see if those things which were being deferred, if I have that correct, what that dollar amount would be.
It would be minus that 40,000.
Yeah, so what's in the packet is essentially the same document that was in the finance committee packet. So that included the marquee sign, and that's why the document was updated to explicitly say that the board can approve any rendition of the plan presented tonight. So if the board feels like the monument sign's not needed, remove it and approve the other items, or approve 1, 2, none. The board can approve any of these items or any of the items on the total list that was presented on that spreadsheet. So that's why the 269 number that's on there is just from last week. But the health department did prioritize and did remove the monument sign, but I just kept it on the actual spreadsheet just for simplicity from last week. And then I guess to further clarify, Amanda and I did meet last Friday and went over the actual prioritization process. The items that are presented are from the, we both felt like, and mostly the health department felt like these items are priority 1 period. I mean, they're from a larger list that was given to, or from a larger list of requests that was kind of garnered from all department heads. So these requests that are presented tonight are their top priority. If the board feels like none of these are priorities, that's at the board's pleasure. So I guess I hope that speaks to it, that these requests are not going to be presented as 1, 2, 3, 4. The health department believes that important requests, period. So
What would be the total?
219, take away 40?
Yeah, well, so that touchless X-ray temperature check machine is actually for the courthouse. That was a request that they had. But yeah, it'd be the 219,7.
179.
Yeah, yep.
Any further questions for the, Mr.
I
Roberts?
make a motion, we spend the 269,700.
I'd second that.
Okay, now we can vote on it and people can vote their conscience. Either it passes or it doesn't.
We actually already have a motion on the floor for that.
Who made that one?
Ms. Bartelt actually did. And
Right, that
the
motion.
second was.
Ryan Curry.
Ryan Curry seconded.
You did.
Yeah, she made a motion to approve the whole 269.
I made the motion,
Yeah.
but I
Well,
want
she didn't, she said that she wouldn't want to spend for the food bank. So Ms. Bartelt,
to bank is what I.
we don't have any amendments on anything yet. Right now, it's all 269,700.
Question.
So who calls for the question?
Chairman? Look, I think there's just.
Call for a question usually needs a second.
That's why I was just asking if it needs a second. So I was just-
Don't have yet. The food bank is on the line. I'd literally like to hear from them before this. All due respect.
Okay, we
I
can,
believe you need a second for the call, the question.
hear from the food bank quickly.
Or, well.
Well, yeah, I
Procedure
mean,
would be to, is
what's-
there a second? for the
Is there
call?
is there a second for the call to question?
Yes.
Yes? There's a second. So then we vote on that, call the question? Or does it just automatically call it?
Vote on the motion.
On the motion.
Okay. So all in favor of the motion to call the question signify by saying aye.
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 Opposed?
No.
No,
No.
It's close. Give me a roll call, please.
Freddie De La Trinidad,
What are we voting on again?
Vote, this is to call the question.
What's that?
To call the question, so we just go to a vote on the 269,700.
stops. It has to be voted on as it was.
So this is just to say that we're going to vote on it and no more, just no further discussion.
Okay, no.
Trey Geeske,
Yes.
Carl Johnson.
Yes.
Rodney Riley,
No,
Bill Robertson,
Yes.
Steve Shabaka. Jonathan Van Laar,
No.
Dave Wiltsey,
No.
Sherry Bartel,
No.
Tom Wahlberg,
I said present.
Ryan Curry.
No.
Motion fails. Okay, we'll hear quickly from the food bank.
I believe, Hester, are you on the phone to provide more details on the food bank's, request tonight?
Yes, I am. Can you hear me?
Yes, we can hear you. You can go ahead.
Thank you so much. Thank you for this opportunity to just kind of update you about the situation with food insecurity in Boone County and how this funding could help feed some neighbors, right back. The funding would come right back to Boone County to help provide food assistance. 10% of Boone County residents and 17% of children in the county are reported as food insecure. And this increases with the impact of the pandemic and continues to increase with rising food prices and rising gas prices and unpredictable work hours. Many neighbors are working part-time or minimum wage jobs that do not bring in enough income for them to afford the nutritious food they need to feed their families. And when earning low incomes and struggling to put food on the table, they may resort to fast or processed food that does not have the nutrition needed to provide a healthy diet, especially for growing children or seniors with chronic disease. We encourage people struggling with food insecurity to visit our food pantry network so that they can use their limited incomes for necessities such as housing and utilities, and limit the risk of losing their housing. In Boone County, we work with 4 food pantries to distribute food across the county. They are serving a monthly average of 9,400 residents and helped distribute 2.5 million meals in the county last year. Member agencies have access to our online shopping list at the food bank and pay a small shared maintenance fee for the food that they receive. However, they are also limited sometimes by their own resources and cannot always acquire as much food as they need to serve the neighbors coming to them. The funding we are requesting would be to purchase food that would directly benefit these member food pantries and our neighbors. The food that we purchase would be available on the shopping list for them with no fees and would be restricted to those Boone County agencies. Depending on the reporting requirements that would be on the funding, they could also be used to cover the shared maintenance fees for those member agencies until the funds are depleted. We are currently using both these models, what we call a food fund or a Take 100 fund, successfully in other counties, and would be happy to share the reporting requirements with you. The $50,000 that we are requesting could also be spread across 2 or 3 years, allowing us to plan for sustainability of access to food in the county. I'd be happy to answer any questions.
Questions for the food bank, Mr. Bendler?
Sorry, you mentioned 9,400 number for the people you service. Is that per year, per week? I missed that.
That's a monthly average of the number of people that are visiting those 4 food pantries in the county. I will qualify that by saying that is a duplicated number. So it's really 9,400 visits to a food pantry.
Thank you.
Ms. Geesky?
Excuse me, if we are going to give $50,000 to someone to provide meals for those folks here in Boone County, I'm going to offer up a little bit different view. I did a little quick research on the Northern Illinois Food Bank because I'm not familiar with them, to find out that they're a corporation who, as of, let me see, as of April 13th of this year, CEO makes almost $280,000. So I might suggest if we're hell-bent on giving money, why don't we look at some of the Christian food pantries we have in this county? Or we have Empower Boone, because we know that money is going to stay right there. And you can pick and choose, but I would suggest very strongly that if we're going to do this, we give the money to those right here in our county. Lots of churches have food, take collections up and do things like that. So that's what I would suggest.
Any further comments? Barthel?
I have my main objection to the $50,000 to the Northern Illinois Food Bank.
Oh, Ms. Barthel, can you make sure you use your microphone, just so we make sure we get it recorded?
My main objection to giving the $50,000 to them is not that I don't want to give them. It's that some of the people that are receiving this or may receive this money, they have put down that they are a 501c3. They have not filed their 990s for 17, 18, and 19, and 20. They have not filed anything with the federal government, which means after 3 years of not doing anything, they do not have a 501c3 anymore. And this is what I'm questioning. And I have looked and looked and looked. I have actually called other people to look and look and look. And as of today at 3 o'clock, what I'm talking about is not a 501c3 anymore. They did file in 7/29/21 for 21. But what happened to the other years? I hate to throw money out on someone who does not have their taxes done properly, and we don't know where their money went. That's my only objection to giving any money right now to Northern Food Bank until we find out where this is at. And I will go along with what Sherry Giesky has said, that maybe we should look into some of the other type of food banks with the religious outfits and that. Have no problem with that either.
May I respond to that?
Quickly.
So I think you're referring to Empower Boone, and thank you for bringing that to our attention. We did review that, and we certainly require all our member agencies to be in compliance. From our research, they are still in compliance as a 501c3. We agree that they have not filed their 990, but they get 3 years, and the 3-year limit came during COVID, and the IRS is behind in their revocation of those. So they are still currently a legal 501c3, and we will be following up with them to ensure that they file the papers as soon as possible. But we also hate to restrict or limit people's access to food because of one agency's non-compliance with the 990. Thank you.
Okay, let's move this along. If there's any amendments to this, I'd take them. Ms. Bartel?
I'd like an amendment said at this point in time, I have no objection to anything else being paid. I object to the Northern Food Bank being paid until it is actually registered that Empower Boone has all their ducks in a row.
I guess I don't understand what your amendment is. Do you want to?
I have no problem paying all that they want, with the exception of the Northern Illinois Food Bank.
Okay, so you want to remove the Northern Illinois Food Bank from this?
Until everybody has their ducks in a row.
So the motion by Ms. Bartel, is there a second?
I'll second.
Second by Mr. Robertson. Any discussion on that amendment? All in favor, say aye.
Aye.
Opposed? Aye. Okay, motion carries. Northern Illinois Food Bank is removed from that list. Any other amendments? Right. I would make an amendment that we remove the monument from that list. I don't think it's needed.
Second.
There's a motion by myself and seconded by Mr. Wiltsey. Any discussion on that?
What did you say you wanted to remove?
Sign,
Monument?
monument sign.
Mr. De La Trinidad?
Yeah, I just want the record to be known that I actually do agree with the monument sign, just because it lets people know about all the services and meetings and things like that. We already struggle enough to basically let people know what we offer, the services that we provide, and I think it's a very good idea. I gotta say.
Mr. Robertson?
Belvedere Township gets a great deal of response from their sign. When we post something out there, we get a lot of telephone calls for explanations and where they can find it. I think it's a good thing, and every agency in this building can use it.
Any further discussion on that? We have a motion to remove that item from this list. All in favor signify by saying aye.
Aye.
Opposed?
No.
No,
Motion fails. Any other amendments? That being said, have the motion on the table is as amended, this entire list without the Northern Illinois Food Bank on there. Roll call, please. Yep, Ms. Giesky?
Can you clarify
Sure.
exactly what is it we're voting on now?
So what we would be voting on this list is the courthouse sheriff, the touchless x-ray for 34,700. Public health, the monument sign for 40,000. Public health wheels vehicle for 90,000. Public health SUV for 40,000, and public health new laptops for 15,000. So you're looking at about $219,700.
That's what I. Do math on the fly.
There you go. My math teacher would be proud. All right, any other discussion on that? Roll call, please.
Freddie De La Trinidad,
Yes.
Jerry Geesky,
No.
Carl Johnson,
No.
Ronnie Riley,
Yes.
Bill Robertson,
Yes.
Steve Schabacher,
Yes.
Jonathan Van Laar,
No.
David Wiltsey,
No.
Sherry Bartelt,
Yes.
Tom Wahlberg,
No.
Ryan Curry.
Yes.
Oh, because Ray's not here. Motion carries. There's only 11. But Ray's not here. The motion passes. Next item, we accept a motion to approve the special use permit extension request from